Friends, I am Dr. K.D. Mishra and today we will discuss blood coagulation, that is clotting of blood. When there is a cut in some part of the body, the blood starts flowing called hemorrhage. To control that, blood coagulation should be there, a clot should be formed to check the hemorrhage of blood. So, today we will discuss blood coagulation. Blood coagulation is the process by which the liquid blood is converted into a semi-solid state called as blood clot. This phenomena is called blood clotting or blood coagulation. It helps in preventing the blood loss due to damage of blood vessels. Blood contains about 50 substances that affects coagulation of blood. Some of these promotes coagulation and some of these prevents coagulation. Those which promotes coagulation are called procoagulants, whereas those which prevent coagulation or which prevent blood clotting, they are called as anticoagulants. So, first of all, Morowitz studied the basic mechanism of blood clotting. Blood clotting takes place in three essential steps. When there is a cut in a blood vessel and blood starts flowing, a cascade of reaction starts. There are about a dozen of clotting factors which acts one after the other in a cascading manner. As a result, a complex is activated which is called as Prothrombin activator, and this initiates the blood clotting. Now, if we just simply wants to understand the phenomena of blood clotting, then there are three basic factors. Number one is a protein found in the blood plasma called Fibrinogen. For clotting, this Fibrinogen, which is a soluble protein, has to be converted into Fibrin. This Fibrin forms a meshwork in which the formed elements of blood and plasma proteins are trapped and a clot is formed, thereby preventing the blood loss. But for converting Fibrinogen into Fibrin, an enzyme is needed called thrombin. This thrombin is also present in the blood, but it is present in an inactivated form called prothrombin. This prothrombin, when it is acted upon by another factor which is called a thromboplastin, the thromboplastin converts prothrombin into thrombin, and this thrombin converts Fibrinogen into Fibrin. That is how the whole process of blood clotting can be summarized. Now, prothrombin activator, it converts prothrombin to thrombin in presence of calcium ions. This is very important factor because the calcium ions are very important in conversion of prothrombin to thrombin. The thrombin is an enzyme that converts fibrinogen into fibrin fibers that enmesh blood cells, platelets and plasma proteins to form a clot. Now, conversion of prothrombin to thrombin. Now, prothrombin is a protein formed in the liver. Its concentration in blood is about 15%. It is a alpha 2 globulin molecule with a molecular weight of 68,000. It is a unstable protein which can be broken into monomers called thrombin monomers. The molecular weight of thrombin is less than half of the prothrombin, that is 33,700. Now, vitamin K has a vital role in the whole process. It is essential for formation of prothrombin and some other clotting factors. So, deficiency of vitamin K may be due to liver diseases. This results in bleeding tendency because the clotting factors are not properly synthesized in the liver due to deficiency of vitamin K. So, calcium ions and vitamin K, these two are essential for blood clotting. Now, conversion of fibrinogen to fibrin. See, fibrin monomers are initially linked with weak non-covalent bonds. Thrombin activates platelets to release fibrin stabilizing factor. Now, the role of fibrin stabilizing factor is that it activates formation of covalent bonds between fibrin monomers. As stated earlier, that the fibrin monomers are combined together with weak non-covalent bonds, then the fibrin stabilizing factor activates formation of covalent bonds between fibrin monomers. This results in formation of cross linkage between adjacent fibrin fibers. Finally, a three-dimensional meshwork is formed of fibrin fibers in which blood cells, RBCs, WBCs and platelets are trapped along with the plasma proteins, thereby forming a clot. Now, here in this picture, you can see the whole process depicted in a flow chart. You know, the prothrombin is a molecule of about 68,700 molecular weight. It is acted upon by prothrombin activator plus calcium ions. This converts prothrombin into thrombin, which is just less than half of the molecular weight, that is about 33,700. Now, this thrombin, which is an enzyme, converts fibrinogen into fibrin monomers. This process is again helped by the calcium ions, and the activated fibrin stabilizing factor also help in this process in formation of cross-linked fibrin fibers, as we have already seen that the non-covalent bonds are converted into covalent bonds. So, therefore, forming a tough fiber network forming the clot. Now here you can see the whole process. Prothrombin is there in the blood, fibrinogen is there in the blood, the prothrombin is converted into thrombin, the thrombin converts fibrinogen into fibrin, the fibrin fibers make a meshwork and that forms a clot. Now, formation of blood clot. As I just mentioned, in the meshwork of fibrin, different form elements and plasma proteins are trapped, thereby forming a clot. The fibrin fibers, they adhere to the ruptured surface of blood vessel, thereby forming a intact clot. And as soon as the clot is formed, within few minutes, a process occurs that is called clot retraction. Means the clot becomes tough and it retracts and it completely plugs the damaged blood vessel, and in this process a colorless transparent fluid comes out of the clot on the surface of clot, that is serum. That means blood minus formed elements minus fibrinogen is serum. Now, in the process of clot formation, blood platelets plays a very important role. The platelets assist fibrin fibers to form covalent linkage and also releases a factor like fibrin stabilizing factor. Platelets also releases contractile proteins called thrombostatin, actin and myosin. These are the proteins which can be retracted, which causes a strong contraction in the platelet spicules. These are attached to the fibrin fibers as well as the surface of the blood vessel. This process is further accelerated by thrombin as well as calcium. As I stated earlier, calcium plays a very vital role in blood clotting. Now, the process of clot formation is a process where a positive feedback mechanism is observed. That means as soon as the process of clot formation begins, it stimulates, it potentiates the process further, and secretion of the thrombin, formation of thrombin is accelerated, and as this process goes on, this process is increased by a positive feedback mechanism till a clot is formed and till the leakage of blood vessel is ceased. Now, coming on to the most important part of this topic is the clotting factors. As stated earlier, that the process of clotting is controlled by a dozen of clotting factors which acts in a cascading manner. So, this is cascading clotting phenomena. These factors, they initiate the next one, and next one initiate the activation of next one, and so on. So, there is a cascading effect of clotting factors. There are 12 main clotting factors which we will discuss just now. Factor number 1, that is fibrinogen. Fibrinogen is a soluble protein which is found in the blood plasma. Its molecular weight is 340,000. Its concentration in blood plasma is 2000 to 4000 μg per ml. Fibrinogen is converted into fibrin by thrombin. It is synthesized in liver. So, this is the first factor, that is fibrinogen. It is a soluble protein. It is already present in the blood plasma. The second factor is prothrombin. It is also a plasma protein. Its molecular weight is 62,700. Its plasma concentration is about 100 to 150 μg per ml. It is also synthesized like other in the liver. Vitamin K is essential for the synthesis of prothrombin. During clotting process, prothrombin is converted into thrombin. Thrombin converts the complex fibrinogen molecule into fibrin monomers. It also activates the blood platelets to release thromboplastin. It is primary inhibitor of thrombin is antithrombin 3. The primary inhibitor of thrombin is antithrombin 3, heparin cofactor 2nd. So, these two inhibits the activity of thrombin. Now, coming on to the factor number 3. Factor number 3 is thromboplastin. It is a factor released by the tissue, therefore, it is called as tissue thromboplastin, that is TPL. It is an initiator of extrinsic pathway for blood coagulation. In blood coagulation, for activation of factors, there are two pathways. One is the extrinsic pathway and another is the intrinsic pathway. As the word suggests, extrinsic pathway means the cascade of reaction which is initiated from outside the blood vessel. So, it is called as extrinsic pathway. When this pathway is initiated inside the blood or inside the blood vessel, it is called intrinsic pathway. So, it is an initiator of extrinsic pathway for blood coagulation. Thromboplastin converts prothrombin to thrombin in presence of calcium ions. Calcium ions are very important. If you leave first two processes in coagulation, in all the processes calcium ions are important. Therefore, factor 4 is calcium ions. So, factor number 1 is fibrinogen, factor number 2 is prothrombin, factor number 3 is thromboplastin which converts prothrombin to thrombin, and factor number 4 is calcium. So it is very easy to remember all these. These are all present inside the blood. Calcium ions are essential for blood clotting. It acts as a cofactor. It is essential for the formation of both intrinsic and extrinsic thromboplastins, and also for conversion of prothrombin to thrombin. In nutshell, calcium is very important for blood clotting. If calcium is not present in sufficient amount, normally calcium is present in sufficient amount in our blood. So whenever we are storing the blood in blood bank for transfusion, the calcium has to be removed from that so that blood coagulation can be checked. Now coming on to the factor number 4. Factor 4 is called labile factor or accelerator globulin. It is also called proaxillerin. It is a large protein molecule of about 333,000 molecular weight. It is also present in plasma. It is necessary for conversion of prothrombin to thrombin. Factor number 7 is proconverting or stable factor. Vitamin K dependent clotting factor it is. Vitamin K is necessary for it. During the process of blood clotting, it is changed into convertin. Now another very important factor in blood clotting is factor number 8. It is called Anti-Hemophilic Factor, AHF, or Anti-Hemophilic Globin, AGH, or platelet cofactor. Now this factor helps in formation of intrinsic thromboplastin and prothrombin conversion. It remains associated with fibrinogen. It helps in the breakdown of platelets and liberation of cofactor 1 or thromboplastin factor. Therefore, it is anti-hemophilic. It is called anti-hemophilic because it prevents the disease called hemophilia. In hemophilia, this factor is absent. Absence of this factor causes the genetic disease called hemophilia. It is a X-linked disease. The gene of hemophilia is located on X chromosome. It is a sex-linked recessive trait, and its deficiency results in classical hemophilia in males. Why it is in males? Because the female has 2 X chromosome, whereas the male has only 1 X chromosome. So since it is a recessive disease, if it is present on 1 X chromosome of female, the female will not show the symptoms of disease because a normal gene is there to dominate this. But in case of males, if there is only 1 X chromosome, and if the defective gene is present on that X chromosome, that means male is bound to be defective. So therefore, this disease and all the X-linked recessive diseases are found more in case of males as compared to females. Females are mostly carriers of such type of diseases. Another factor is factor number 9. It is popularly called as Christmas factor or plasma thromboplastin component PTC or platelet cofactor second. This factor is needed for intrinsic thromboplastin formation. Its absence leads to a kind of hemophilia called Hemophilia C. It is a genetic disease transmitted by X-linked recessive trait in males, as I just discussed in case of Hemophilia A. It is called Christmas factor as this disease was first diagnosed in a person whose name was Christmas. So, after his name, this factor is known as Christmas factor, and the disease caused by this defective gene is called as Hemophilia C. Now, another factor, that is factor 10, is called Steward factor. Its primary function is conversion of prothrombin to thrombin. Then factor number 11, that is called as plasma thromboplastin antecedent. It is responsible for formation of thrombin, and its deficiency leads to mild bleeding tendency, which occurs in case of Hemophilia D. This is also a sex-linked disease, but here this disease is of dominant nature. That means the gene is dominant. So, in case of male and female, both, this disease is seen. In fact, it will be more effective in case of females as compared to male, because it is a X-linked dominant disease. Now, factor 12, popularly called as Hagman or surface factor. It is activated when it comes in contact with surface. Therefore, it is called surface factor. It activates protein splitting enzyme kallikrein to produce plasma kinins. Then factor number 13, it is called as Lucky-Laurent factor, LLF, or fibrin stabilizing factor. It causes stabilization of fibrin. That means after formation of fibrin, the clot has to be stabilized with calcium. It converts soft fibrin into a solid clot. Congenital malfunctioning of LLF causes poor wound healing. If there is a malfunction or there is a deficiency of LLF, it will cause poor wound healing. The wound will be softer and it may not retain for a longer time. Now, some other factors in blood clotting, they include high molecular weight kininogen or Fitzgerald factor. It is a contact factor for hemostasis formed in the liver. It cleaves the prekallikrein to bradykinin, which is a vasodilator. Another is prekallikrein or Fletcher factor. It forms a complex with factor 11. It is mainly responsible for contact activation of the process of hemostasis. So, these are supporting factors. Otherwise, the primary factors are factor 1 to factor 13. Similarly, some other factors are there which include thrombomodulin. Thrombin binds with thrombomodulin. This complex activates protein C and serves as anticoagulant. In the initial part of the lecture, I said that the blood clotting factors are of two types. Those which promotes coagulation are called procoagulants, and those which inhibits coagulation are called anticoagulants. So, it is that type of a factor. Then protein C, it activates factor 5A. When we use the small bird A, it means active form of the factor. So, it activates factor A and factor 8A. It is a vitamin K dependent and is activated by thrombomodulin, this one. Now, protein S. Protein S forms a complex with protein C, and this complex of protein S with protein C inactivates factor 5th A and factor 8th A. That means it prevents coagulation. Another is antithrombin 3. This is a protease inhibitor. It inhibits factor 9A and factor 10A along with factor 7A. So, this inhibits the whole process of clot formation. Tissue factor pathway inhibitor, that is TFPI, it inhibits factor 7A and factor 10A. So, all these are inhibitors of coagulation, that is anticoagulant factors. Now, the mechanism of blood coagulation, as I stated earlier, that the enzymes which are responsible for coagulation, the factors which are responsible for coagulation are present in the blood plasma itself, blood. They are present in an inactive form, and when they are activated, only then they perform their action. So, they are present in the form of proenzyme, then they are converted into active form and works as an active enzyme. So, to indicate the active form of a factor, word A is added to the Roman numeral. As you have seen, all the factors, clotting factors are shown by Roman numbers. So, if we write small a after the Roman number, it indicates the activated factor. After conversion into active forms, their enzymatic action causes these successive cascading reactions, as we have earlier mentioned, that all these factors works in a cascading manner, one after the other. Now, to understand the whole process of blood coagulation, there are three main steps involved in that. The first one is the activation of Steward power factor 10. This is the most important step in the formation of clot. That means formation of prothrombin activator. Second one is formation of thrombin from prothrombin. Now, this activator plays an important role in conversion of prothrombin to thrombin. And third one is the formation of fibrin from fibrinogen. So, in simple sequence, we see that first of all, the activation of Steward factor 10 has to be achieved in the process of blood coagulation. Once it is achieved, it is instrumental in converting prothrombin to thrombin. This thrombin enzyme converts the fibrinogen into fibrin, and that is the important step in the formation of clot. Now, as we have seen just now that the most important thing in the process of coagulation is the activation of factor number 10. So, the conversion of a Steward power factor 10 into factor 10A, this phenomena is called as prothrombin activation. This is achieved by two pathways. One is extrinsic pathway that begins from outside the blood vessel, from outside the blood, from the tissue, as we have seen in case of tissue thromboplastin. Another is intrinsic pathway, which is initiated from inside the blood plasma. So, soon after a blood vessel is ruptured, when there is a bleeding, both intrinsic and extrinsic pathways occurs simultaneously. The extrinsic pathway is speedy. It is more speedy as compared to intrinsic pathway. The intrinsic pathway is little slower as compared to extrinsic pathway. Now, intrinsic pathway can be summarized into 4 steps. Step number 1 is the activation of factor number 12, the Hagman factor. When it comes in contact with the exposed surface of blood vessel, in blood vessels there are collagen fibers. The collagen fibers are negatively charged. So, when this factor comes in contact with the negatively charged collagen of injured vessel, Fibrinogen and kallikrein acts as cofactors. This causes activation of factor 12 to factor 12A. Now, what happens? As soon as the blood vessel is ruptured, due to negative charge on the collagen fibers, Fibrinogen and kallikrein acts as cofactors, and these two converts the factor 12 into activated form of factor 12, that is 12A. Here you can see in this flow chart, when there is a vascular injury, a contact with the exposed collagen, negative surface, negatively charged surface, plus cofactors, high molecular weight Fibrinogen and kallikrein, and these converts factor 12 into factor 12A. This is the most important step that occurs in the process of blood coagulation, that is in the intrinsic pathway. Now, you will see a cascadic sequence of reactions. In step 2, factor number 11 is activated, It is activated by factor 12A. The factor 12 which is activated in the previous step, now it activates the factor 11. So, factor 11 is converted into factor 11A. Further, in the next step, that is step 3, factor number 9 is converted into 9A, that is activated form of 9A. So, first of all, factor 12 is converted into active form, that is 12A, then 12A converts factor number 11 into 11A, then factor number 11A converts factor 9 into activated form of factor 9. So, this is how stepwise the activation of factors occurs in a cascading manner. Now, in the fourth step, now this factor 9, activated factor 9 acts upon factor 10. This factor 10 is activated into factor 10A. So, this is Steward power factor which is now activated. This is the important final step in the intrinsic pathway, that through the cascading reactions starting from factor 12 to factor 11 to factor 9 and finally factor 9 activated form activates factor 10. In this process, factor 8A, that is activated form of factor 8A, phospholipids, calcium ions acts as cofactor, that is in conversion of factor 10 into factor 10A, the factor 8A, phospholipids, calcium, all these acts as cofactors. One clotting factor acts for activation of the other in a sequence. Therefore, intrinsic blood coagulation process is called enzyme cascade hypothesis. So, as we have seen, one factor is activating the other factor in a cascading manner. Therefore, it is called enzyme cascade hypothesis. Now, here in this flow chart, you can see the whole intrinsic pathway. Here, if when there is some trauma with the contact of negatively charged collagen, the factor 12 is activated into factor 12A. This is then factor 12A, this is helped by high molecular weight kininogen and precalcitonin. This activates factor 11 into factor 11A. Then factor 11A activates factor 9. In this process, the calcium ions helps. Here, in this process, thrombin is formed. Thrombin plus factor 8A plus calcium, all these activates factor 10A. Now, this factor 10A plus the thromboplastin and phospholipids from the platelets, this helps in conversion of prothrombin to thrombin, and thrombin finally converts the fibrinogen into fibrin. Now, as I said earlier, that both intrinsic and extrinsic pathway goes on hand in hand, that is simultaneously. Here we can see in the extrinsic pathway, as soon as there is an injury in blood vessel, the tissue of blood vessel releases thromboplastin, which plays a key role in blood coagulation. This is called extrinsic pathway because this thromboplastin, that is TPL, tissue thromboplastin, is released from the tissue, not from the blood itself. And the step 2 is the activation of 7th factor. TPL converts factor 7 to activated form of factor 7. So, TPA factor 7 is converted into factor 7A. In step 3, factor 10 activation, that is factor 7A converts factor 10 into active 10A. So, here you can see from both the pathways, from extrinsic pathway as well as from intrinsic pathway, finally factor 10 is converted into activated form, that is 10A. As stated earlier, calcium plays a very vital role in blood coagulation or blood clotting. In various steps, excluding first few steps, that is first 2 steps of intrinsic pathway, calcium is required for all the blood clotting reactions. So, it is very important for clot formation. Normally, the calcium level in blood is sufficient. It does not cause any problem in blood coagulation. But when we store the blood, we deionize the calcium with citrate ion, which precipitate these substances like calcium oxalate ions are used for precipitating the calcium, so that coagulation of blood does not occur when blood is stored for either investigation purpose or for the purpose of blood transfusion, or for the purpose of storage in the blood bank. Now, blood coagulation process has to be prevented or regulated so as to check formation of any clot inside the blood vascular system. Such a clot is called thrombus, and this phenomena is called as thrombosis. When a clot is formed inside the blood vessel, it is called thrombus. So, when this thrombus passes to the minute blood vessels and capillaries, it chokes the blood flow in that part, that may result in severe consequences. To prevent vascular stasis, that means the flow of stoppage of flow of blood, the flow of blood should be maintained. Vascular epithelium releases a substance called thrombomodulin. This thrombomodulin prevents further coagulation by activating 2 proteins. One is protein C and another is protein S. So, these 2 forms a complex. Endothelial cells also inhibits platelet activation, as stated earlier, that when platelets are activated, they release thromboplastin, and thromboplastin plays a key role in converting prothrombin into thrombin. So, this is prevented so as to prevent formation of clot inside the blood vessels. Now, another substance which plays a key role in preventing thrombus formation is the heparin antithrombin 3 system. Heparin is synthesized by the mast cells and basophil cells. It is a natural coagulant found in the blood. Heparin activates antithrombin 3, forming a heparin antithrombin 3 complex, which prevents the activation of many clotting factors, including 9, 10, 11, and 12. So, by inhibiting these factors, the blood coagulation is prevented inside the blood vascular system, preventing formation of thrombus. Now, some other factors responsible for regulation of blood clotting. One is the negative feedback by thrombin. When the thrombin is formed, a negative feedback mechanism is initiated to inhibit the process of clot formation any further. Then liver also plays an important role in preventing the formation of clot inside the blood vessels. That is, it inactivates the activated clotting factors after their work is over, so that they will not cause any blood clotting further. Then platelets also plays an important role in the regulation of clotting. The platelets important in activation of factor 10 in the clotting reaction starts with the adhesion of platelets to the injured vessel surface. Clotting reaction is restricted to the site of injury. The platelets are found throughout the plasma, but when there is an injury, these platelets are restricted to only the site of injury, thereby preventing clot formation in the blood vascular system. Now, there are two parameters which are studied in common practice whenever there is a surgery. One is the bleeding time and another is the clotting time. Bleeding time is the time needed for cessation of bleeding, with how much time is needed for stoppage of bleeding. In other words, it is the duration of blood flow after skin puncture. If you puncture the skin, for how much time the blood continues to flow, that is called as bleeding time. It is usually determined by Duke's method. Either the fingertip is punctured with a sterilized needle, or the earlobe is punctured, and it is the blood is wiped off regularly until the blood stops flowing or the bleeding stops. The normal bleeding time is 3 to 5 minutes. Similarly, the clotting time is the time required for formation of a clot. It is determined as a standard routine procedure performed before any surgical procedure, and clinical laboratories it is routinely conducted by a method called capillary method. The normal range by this method is 2 to 8 minutes. That is, it takes about 2 to 8 minutes for formation of a clot. There is another method, that is Levite method. The range by this method is 5 to 12 minutes. So, if the clotting does not occur within this period, then it may be dangerous for the patient. Now, abnormalities of blood coagulation. There are certain hemorrhagic disorders which can be grouped into two categories. One category is those of inherited diseases, defects. Among these are hemophilia due to factor number 8, the Christmas disease due to factor number 9. These are common amongst the inherited coagulation disorders. Then there are some acquired defects. The common are thrombocytopenia related to the platelets, then vitamin K deficiency, in case of liver failure also. Acquired defects are more common than inherited defects. These are more seen in the population. Then platelet defects are more common than coagulation defects. If there is a defect in platelet formation, there is a less number of platelet, then that type of defect is more common as compared to any defects due to deficiency of other clotting factors. Now, hemophilia A, it is a bleeding disorder. If there is a cut, the bleeding persists for quite some time. This is due to deficiency of factor 8. It is commonly called as classic hemophilia. It's a hereditary disease which is X-linked recessive disease. Males are mostly affected by this, whereas women are mostly normal and carrier. It is characterized by bleeding tendency resulting in tissue hematomas. Blood is accumulated in the tissue, bleeding in the joints called as hemarthrosis. Then it leads to severe crippling called as hemarthropathy. Means there is defect and damage in the joints due to accumulation of blood. In hemophilia A, mild to moderate bleeding persists after surgery or a trauma. In spite of formation of clot, the bleeding persists for quite some time. It may persist for weeks. It is diagnosed by the assay, that is estimation of factor 8 in the plasma. For treatment, the factor 8 is transfused or fresh blood is given because the stored blood factor A is factor 8 is rapidly destroyed. So, if the blood has to be transfused, then it should be fresh one. Then hemophilia B, that is Christmas disease. It is also a genetic disease due to deficiency of factor 9 or anti-hemophilic factor B. It is called Christmas factor. It is a sex-linked recessive disease. The clinical features of this disease are similar to hemophilia A. It is diagnosed by the assay of factor 9. Treatment is the replacement of factor 9. Thrombosis. Thrombosis is a phenomena in which thrombus or blood clot is formed inside the blood vessels. The major complications of thrombosis is thromboembolism. That is, emboli are dislodged in the microcirculation, especially in the visceral organs, such as brain and heart. These are very vital, and when there is a blockage in heart, it leads to coronary thrombosis or leads to heart attack. And when it is blocked in the cerebral part of the brain, it leads into paralysis or stroke. Now, in the last part of this topic, we will see the role of anticoagulants. Anticoagulants are used to prevent blood coagulation for various purposes. For preventing coagulation of blood sample, when blood sample is drawn for various investigations, then it has to be mixed with anticoagulants so as to prevent coagulation. For prevention of preservation of blood for transfusion, and for anticoagulation therapy, these are used. Now, the commonly used anticoagulants for collection of blood are EDTA, that is ethylene diamine tetraacetic acid. It is commonly used in the form of sodium and potassium salts. It forms an insoluble complex with calcium. As you know, the calcium is very important for blood coagulation. So, it binds with calcium and acts as a chelating agent on blood calcium. Then sodium citrate, trisodium citrate is commonly used. It prevents coagulation by inactivating calcium ions. Then oxalates of sodium, potassium, ammonium and lithium acts as anticoagulants. Double oxalates containing ammonium and potassium oxalates are used. They are called balanced oxalates. Another anticoagulant used is the heparin. As we have already mentioned, that heparin is synthesized in the mast cells. These are natural anticoagulant. It is commonly used in the form of sodium and potassium and ammonium salts. It neutralizes thrombin, preventing coagulation for about 24 hours. It facilitates action of antithrombin 3 and prevents conversion of fibrin from fibrinogen. So, in this way, heparin acts as a natural anticoagulant. Now, certain anticoagulants are used in therapy also for prevention of thrombosis. Oral anticoagulants include vitamin K antagonists like warfarin, protein C and protein S. We have already seen these two protein makes a complex which prevents coagulation. Then dicomarol, then intravenous or subcutaneous anticoagulants include heparin and hirudin. Hirudin is a anticoagulant of animal origin. The leech, which is known as a hirudo, secretes a anticoagulant known as hirudin. That's all for today. Thanks.